Okay, class, we're going to use this video as a reference to how to complete your Fisdap requirements for your non-traditional clinical experience. You guys are going to be having your clinical time basically embedded into your field time for a total of 144 extra hours. You're going to use that reference sheet that's attached as well. That'll give you clear directions on how to complete those hours, but then I'm also doing this video to show you what's going to be required on the Fisdap side of it. So you're going to, as always, document a clinical shift by adding a clinical shift here, clicking on that button. You'll see the site come up. The very first option is your clinical time non-traditional. Use that as your, instead of the other drop downs of whatever other clinical site you'll be using. So clicking on the non-traditional time, the date required, let's input the date of 12/19, that's today. Start time, whatever that normal start time would be, and duration. So most field shifts are either going to be 12, 24, or 48-hour long shifts. So whatever format you're doing your ride along in, that's going to be the same as this. There's that, we'll do that 48. Your base department is still going to be an ambulance. That's the only option for non-traditional time. So click on that, and we're saving that shift that we have just built in. So once Fisdap gets that shift built and in place, we are going to then add patients as we normally would. You can use the same patients that you have encountered in your field time to document this on your Fisdap. So preceptor wise, you can either add your field preceptor or you can include me. Essentially, the only time you're going to include me as the preceptor is if we do one of those 8-hour in-class makeup clinical times. So you can just pick your field preceptor and then go through as you normally would for any other Fisdap encounter. You did the interview, you did the exam. If the patient requires airway management, we're always documenting only successful patient airway attempts. We're not documenting any unsuccessful. So if it took you more than one try, you don't need to document those unsuccessful tries. Their AVPU status, age, genders, and then down to their complaints, type as or click in as many complaints as you can. Fever, diarrhea, breathing problems, for whatever this issue might be. Primary impression, the two most that closely fit this patient. We'll do a cardiac symptom there, and then possibly a, let's just say respiratory on this side. Anything with that golden diamond is something that is very important, that is going to meet your graduation goals. Patient criticality, as always, and then you're probably familiar with how to input these already, but you're just putting in your vital signs here. You're putting in any airway treatments that you did here. Again, that you performed everything successfully. Any cardiac issues here, documenting what kind of rhythm they were in, any extra cardiac procedures that were done, venous access, of course, meds that were possibly pushed, and then other various treatments here. Now, in the clinical setting also, they don't always have to be ALS patients. I would like it if you would document some BLS patient encounters in there as well. All right, and last but not least, a nice narrative that essentially tells me what you saw when you first encountered the patient, what was done, any patient reactions, negative or positive, and then if you can, a final disposition of what happened to them in the ER. And then simply save that shift and then carry on as you normally would, documenting the rest of those patient encounters. I would like to see a minimum of 6 on there, but I understand you don't always get a busy shift in the field like you would in a traditional clinical setting, so we do have some allowances for that. So let's take a look at what Ben did for his clinical encounters here. As you can see, these ones in the green are the documented clinical non-traditional hours. So this one on November 13th, that was an 8-hour shift we did in the classroom, documenting patient encounters, doing scenarios and skills, etc., like that. Down here, he had a 24-hour shift that he documented in parallel with this field shift here just documenting the same patients, probably adding in a few BLS patients as well. Here's a 48-hour shift. Here's another 24-hour shift that were documented parallel with a field shift as well. All right, that pretty much is going to be the conclusion. Oh, other than that, all I would really like uploaded onto these shifts are going to be a daily evaluation from your field preceptor as well. So that concludes a brief tutorial on your non-traditional field encounters.